Coronavirus or SARS-CoV-2 moves fast. People infected can spread it before showing any symptoms or knowing they have it. To slow down this potentially fatal virus, experts have pointed to a multi-pronged approach: test, trace, isolate. To test, you need things like test kits, labs, and swabs. And to trace, you need healthcare workers called contact tracers. Problem is, there's not enough of them. Prior to the pandemic, there were an estimated 2,000 contact tracers in the US.
You need about 15 contact tracers per 100,000 in a non-emergent situation. When you're in pandemic, we estimate that to double at the very minimal.
Contact tracing, a pretty classic strategy, is you sit with that person either in person or virtually, and you figure out who have they come in contact with. And obviously with diseases that are respiratory in origin, you really want to know who have they been physically close to where they could have potentially spread that virus.
Our first case of COVID in Washington State had about 70 contacts that needed to be contacted and followed for 14 days. So you can see how quickly, 200 cases a day blossoms into an enormous amount of work.
To combat both the shortage of workers and the speed of transmission, many public health officials are looking for a solution in technology. Early versions of COVID smartphone apps in states like North Dakota and Rhode Island logged locations of infected individuals and even whom they've come into contact with. Rhode Island's Crush COVID RI app automatically records a user's GPS locations for the past 20 days. If the person tests positive, they can opt to share this log with the state health department. Apple and Google have also launched a contact tracing system. Their joint technology, called exposure notification, could allow their smartphone users and overwhelmed health officials to possibly detect when a person has been exposed to the coronavirus. Essentially, they've created a framework for developers of future contact tracing apps to get contact data directly from Apple and Android devices, but that is decentralized from government databases. Here's how it works. Smartphones installed with their exposure notification system use Bluetooth to talk with other devices also running the apps and acting as a beacon. Each device is given a randomly generated number or key that changes every 24 hours to prevent tracking users. Another randomly generated key called a rolling proximity identifier changes every 15 minutes, and this is used to broadcast to any other devices on the lookout for these signals. When a device detects another Bluetooth beacon, it locally records detected keys and other metadata like timestamps and signal strength used to gauge proximity. The distance between devices is estimated based on their signal strength. The stronger the signal, the closer the devices are to each other. After testing positive for coronavirus, it will be up to each user to upload their device logs.
Every single phone that is running this service is on a regular basis sending out very short little chirps over Bluetooth. And the chirps are not connected to your identity. It allows all of us who would be using this system to recognize that we had been in medically significant proximity with someone who's infected. Your app would notify you and would tell you how to get in touch with the public health authority so that you could talk to a contact tracer, get instructions about what to do, and help contain the spread of the disease.
Bluetooth was designed as a short-range wireless technology to connect gadgets, not track coronavirus. The good thing about Bluetooth is that it's incredibly common, basically standard on all Apple and Google smartphones. The trouble is, Bluetooth operates on a frequency unlicensed by the FCC, meaning a lot of other devices use it too. Things like Wi-Fi, cordless phones, baby monitors, and microwaves use this 2.4 gigahertz wavelength, creating interference that could affect measuring exact proximity. Nor can Bluetooth Detective 2 phones are separated from a barrier like a wall or window. Also, Bluetooth range isn't really a perfect circle. Depending on the antenna shape, size, power, and its position, the range of a Bluetooth device could just as well look like a peanut or an oval.
You're going to have things like false positives. So for example, the phone is going to think that it's close to another phone or another device, but it'll be wrong. Or you'll have a false negative. For whatever reason, maybe the bodies of two people are positioned in a certain way, those two devices are not going to register as being in close contact, even though they are.
It's the combination of false positives and false negatives combined with the potential uses for this technology that I have issue with. If it's one thing to generate the technology or use the technology to just generate alerts that help people to stay vigilant about monitoring their symptoms or perhaps get testing. But it's possible that when you walk into a store or your employer requests that before you're permitted back to work, that you show the results of these apps, that you essentially voluntarily use these apps and demonstrate that you were not infected. And I think that has some real danger.
And there's a whole nother set of problems, which is, are people going to use this kind of data to troll?
For example, generate alerts so that people don't leave their house, maybe around election day, or essentially create denial of service attacks to make sure that the app isn't alerting in areas where there might actually be a kind of a pop-up or spike in infection.
Well, what happens if not that many people want to download an app? Even if you download an app to record a successful contact, the other person that you have contact with also has to download the app.
Technology can be really important, but it really has to be owned and managed by trusted partners in the community. And that's where really our public health folks come into play. Make sure you test it at the right levels of the public health system, including at the local level, to ensure that whatever you came up with, even if it was informed, really is practical in terms of implementing it.
There's also this critical component to traditional contact tracing where you're not just trying to get information from a case. You are also providing them education, you're providing them support, you're providing them access to what we call wraparound services. So if they need childcare, or if they need food services, or if they need financial support in order to effectively isolate themselves, it is the role of the contact tracing process to link those people to those sources of care.
Like a lot of technologies in health and healthcare, often there's a lot of hype that they're going to solve all our problems, that they're going to allow us to replace people and do things in a very efficient, automated way. They're not going to solve all of our world problems. They're not going to get rid of this virus. But what they will do is they'll be a tool for contact tracers to use. It'll make the jobs of contact tracers a little easier, a bit more efficient, a bit more effective. And that's good. That's worth doing. They're not a panacea, but they actually are an important part of the solution to keeping the virus under control.